Today we had a poisonous gas leakage at Visakhapatnam. This presentation deals with the treatment and the precautions that we have to take from the poisonous gas called styrene. Now, what is styrene? Styrene is a sweet smelling, colorless liquid that evaporates easily. It often contains other chemicals that gives it a bad pungent odor. Styrene is used to make rubber and plastic packaging, electrical and thermal insulation, fiberglass, pipes, automobile parts, etc. Now let's see the first aid treatment for styrene poisoning. It can affect eyes, skin and even lungs. And in the eyes, it can cause watering, redness and swelling. And what is the treatment that we can do for this? Flush water on eyes 15 minutes continuously while holding the eyes open. Still, if the symptoms persist, transport to the nearby medical facility. On the skin, it can produce redness, swelling, pain, and blisters. Now, what is the treatment for this on skin irritation? You have to remove the contaminated clothing immediately, and after that, flush the skin with large quantity of water, at least 15 minutes, followed by washing with soap and water. All the clothes should be washed before reuse. If redness, blisters, swelling, all this persist even after, shift to the immediate nearby medical facility. And if there is inhalation, it can cause irritation of throat and lungs. There will be vomiting, loss of appetite, generalized weakness and all. The immediate treatment is remove the patient to fresh air. If breathing difficulty, dizziness, unresponsiveness, all this happens, shift to the nearby hospital. The first aid is to give 100% oxygen. Still, if the patient is deteriorating, you have to go for the other resuscitative measures. If the patient had ingestion, rarely only this happens, we have to give the activated charcoal first. And if there is a suspicion of aspiration, you should not give activated charcoal. Styrene can cause prolonged effects like headache, fatigue, drowsiness, insomnia, anorexia, weight loss, pain in the limbs, nervousness, memory impairment, and even it can produce EEG abnormalities. So any of these should not be taken lightly. You have to admit the patient to the hospital and the treatment should be done accordingly. What are the precautions to be taken? If you are inside home, close your doors and windows tightly. If you are outside, close your mouth with wet handkerchief and try to move to an enclosed area. You can use goggles or protective clothing to cover your eyes and a full hand shirt to cover your full hands and wear boots, socks, all this to cover your full body. Do not panic or don't do exercise and don't talk unnecessary. Keep the mind calm and relaxed. Thank you.